Welcome to Watch Your Mouth, the podcast series brought to you by the Ministry of Health and Wellness Oral Health Unit, where we uncover the secrets behind your smile. I'm your host, Dr. Chanel Williams-Beecher, and today we're taking a deep dive into endodontics. Yes, we're talking root canals, the stuff of dental legend. But don't worry, we've got the perfect expert to guide us. Joining us is Dr. Caithlin Williams-Beecher, affectionately known as the Endoqueen of Jamaica. As the country's first and only Canadian Board-Certified Endodontist, Dr. Williams-Beecher is here to bust myths, share her passion, and maybe even make you think root canals aren't so bad after all. She's a fellow in dental academies, the consultant endodontist for the Ministry of Health and Wellness, and works her magic at Emirates Facial and Dental Implant Center in Kingston. Today, Dr. Williams-Beecher will walk us through the wild world of saving teeth, including what happens inside a tooth that needs saving, the latest techniques for making the experience pain-free, and why endodontics is actually pretty cool. So if you've ever wondered what it takes to be an endoqueen or had questions about root canals, stick around. You won't want to miss this. Dr. Williams-Beecher, it's so good to have you here. You have a particular love for your field, Doc. Why are you so passionate about it?
Dr. Dempster, first of all, it's my honor to be here with you. And to be honest, while growing up, Brownstown St. Anne country, as the Kingstonians would call it, I had the experience of going through the public health system for my dental care as a child. And honestly, what I was exposed to was a lot of extractions. So my basic knowledge of dentistry was extracting teeth. So when I started dental school now and learned about endodontics, which is the avenue in terms of dentistry where you can look towards saving the teeth, where a typical filling or shallow filling will not be able to, maintain the health of the tooth, that there was something else that could be done rather than saying, oh, it's a deep cavity, let's just pull the tooth out. So that sparked my interest, because when we used to go to the clinic and extracting the teeth, I would dread those sessions because it really pained me to take people's teeth out. So finding out that there was something that could be done, and then realizing that there was further studies that could be done in order to gain a better understanding and a more specialized focus on doing root canal treatments, because I was only happy at work when I was doing root canal treatments, to be honest. I decided that I wanted to do further studies. And at that time, I was also helping out at the dental school when I finished doing or teaching endodontics, and I said, I think I need a little bit more than just my general dentistry knowledge. So I did go back to school. I went to University of Toronto, 3 years in cold Canada, back in Jamaica now, suffering through the heat, one root canal treatment at a time.
At a time. Dr. Williams-Beecher, you seem to love it, but root canals sometimes get a bad rap. Why is it that this happened? Why is this reputation that root canals are not the best?
Well, it spans from, the dawn of time coming down, the previous approaches and the way that root canal treatments were carried out. It was or tended to be a quite uncomfortable procedure to quite a few patients. Granted, most patients, when they come to see the endodontist, are already in pain. So our goal is really get patients out of pain. If you have an infection, create an environment where that infection can heal. But the approaches that were done in the past had a lot of pain in terms of root canal treatments, and everybody is, they say bad news spreads further than good news. So everybody has an experience. Oh, I did a root canal, and they tell Tom, Dick, Harry, and Sue. I had a lot of pain. I had this. So it passes down from generation to generation. So even though we've had advances in technology, we've had advances in pain management as well, or anesthesia, the local anesthesia, the types that we give, the instruments that we use to administer these anesthesia, and also ensuring that the patient is properly anesthetized before we start whatever we're doing. Because it's not just about, oh, I give you an injection and I start doing what I'm doing. I need to ensure that you are comfortable.
And for our listeners, when we speak about this anesthesia,
for typical Jamaicans, cocaine or the numbing,
or
the
what
numbing
we do
liquid,
to ensure that it's pain-free. So yes, in the past there was a history when root canals were not the most comfortable, but you're saying today, when we visit the endodontist or any general dentist carrying out a root canal, it should be pain-free.
Yes, our ultimate goal is for the process to be pain-free.
And you're going to ensure to numb the area or anesthetize it to ensure that. Doc, as a consultant endodontist for the Ministry of Health and Wellness, have you noticed any unique challenges in Jamaica in our public sector compared to perhaps your time in Canada?
Funnily enough, as much as we would say Canada is first world and Jamaica is third world, people are still the same. So the perceptions in terms of endodontic treatment or even dentistry in general is the same across the board. And in terms of our preventive care and administering those, or having our citizens focus a lot on preventive care, the brushing, the flossing, the visiting the dentist on a regular basis, so we can catch these issues early on. Remember Dr. Phillips speaking in a previous podcast about the caries and the trauma. A lot of times, due to the fear that has passed down generation to generation, we tend to stay away from the dentist when we have an issue, especially if that issue isn't causing pain in the beginning, and we wait till the pain starts. Usually when the pain starts is when things have gotten beyond a point where we can do simple things and more cost-effective things in order to address the problems that's happening. Because when you start coming to me, the question is, can I really save this tooth, or I just have to take it out?
So Doc, you are here to help with pain, but you're still saying prevention would be better than coming to visit you?
Prevention is always better than cure. And for everybody who is bawling about the bottom line, I'm telling you, a simple filling is much cheaper than a root canal treatment.
All right, so there are times when root canals are absolutely necessary. You've mentioned pain, but are there times when a root canal would not be necessary or not warranted?
It depends on the clinical situation that is presented. If it's a tooth or a scenario where the tooth is severely broken down, because the impression sometimes is that root canal treatment automatically ensures that whatever tooth structure was missing will just automatically appear and things are okay. No, the root canal treatment, or what happens in endodontics, we deal with the inside of the tooth. So we deal with getting the nerve and the blood vessels out from inside the tooth. Yes, in some cases, most times it's for pain relief, because that's the most obvious symptoms. For other persons, they do have obvious active infections. And so we have to get rid of the source, which is the bacteria and the breakdown of the tissue inside the tooth. Get rid of that so the body can heal. But outside of that, we have to think about the whole tooth. Why is it that, you needed the root canal treatment in the first place? It could be trauma. You're in a motor vehicle accident, or you're in a fight and somebody thumped you in your mouth, or a child, you ran up in a door or you fell. So there is damage to the tooth structure, and that causes exposure of the nerves and the blood vessels inside. So we have to look at the full picture. Are we able to rebuild that tooth structure for you to get proper form and function for a long period of time to maintain the area? If we can't do that, it really doesn't make sense to do the root canal treatment, because it's like building a house and don't put a roof on the house. What sense or what purpose does that house serve to you if the rain and everything comes in.
I love that analogy. So we're building up the house, but that roof needs to go on top. You and I are speaking about root canals, but some persons still may not know exactly what this root canal is. So for those who are unfamiliar, what exactly is involved in root canal treatment, and what might surprise persons about root canal treatment?
Well, first of all, not many people know of or are familiar with the fact that there are dentists that specialize further than just being a dentist.
True.
And that's where endodontics comes in. So what happens with endodontics, endo means inside, dontics means tooth. So what I do each and every day is I work within the inner portion of the tooth. So yes, we see the lovely enamel and our lovely smiles like yours. That's the outer portion. So I go inside the tooth where we have the nerve and the blood vessels, and I get rid of that from inside the tooth. And so you still maintain the outer shell, the outer form, and it still functions. You brush, you floss, you eat, and everything as per usual. It's just that there's no longer any nerves inside the tooth, so there is no feeling per se. And also we clean everything out on the inside, so that reduces your risk of developing an infection, because that's usually person's greatest fear. Oh, there's something wrong with my tooth, I'm going to get an infection, just pull it out.
Okay, so with your experience, what would happen? What's the impact of untreated infections or decay on your broader health?
Well, just as how we say the eye is the window to the soul, your mouth is the door to your overall health. And so it's very important for you to take care of your teeth. It's not just there to look pretty. Your teeth are there to maintain the shape of your face. So once you start to lose your teeth, especially the back ones, you start losing that height that your face has. So you'll be a lovely 30-year-old and you feel like you're 22, but you look like you're 62. And so you need to maintain the teeth. So we maintain the height of the face. We can still maintain other functions or proper chewing efficiency, pronouncing our words. If you don't have any front teeth, and we know what it was like losing the baby teeth when we were younger and we're lisping, so your teeth are important for your speech as well. In terms of having an infection in the area in your mouth, those infections can spread. It can get into if it is a late stage infection that is not managed properly, you can start affecting other teeth in the area where, okay, you needed root canal treatment on one to manage what was happening, but because everything is starting to spread, you start to affect other teeth. So instead of looking at one root canal treatment, you're looking at two. Or if you're so adamant in taking your teeth out, you're going to be losing multiple teeth, which is going to negatively affect you down the line. Also, in terms of losing your teeth, other teeth in the area will start drifting. So it changes how you bite, changes your chewing efficiency, and it's just a downhill slope from there. And dentures and those things don't necessarily replace the efficiency of how your teeth function inside your mouth.
It sounds to me that endodontics, root canals, are actually playing a role in prevention. Would you agree with that, Doc?
I do, because we have to look at the fact that we have a quality of life to maintain. And as humans, we're living longer. So when life expectancy was probably 44 back in
long
time ago, life expectancy in Jamaica is anywhere between 72 to 74.
Yes.
Right.
Years old.
Yes, years old. So we're living longer. We're going to be doing things, and at 74, you're not walking with a cane or you're just sitting down doing nothing. Yeah. I mean, every 70-odd-year-old I know is still working. And so in terms of if there is something or an issue with your tooth, rather than losing it, you have an opportunity to maintain your teeth and maintain your dentition. Yes, there are the unfortunate circumstances where you will end up losing the tooth. And as much as I'm for saving a tooth, if you lose a tooth, my recommendation is find a replacement, because anything is better than not having a tooth there, because you want to have that form, you want to have that function in the area. So if you lose it, replace it.
So for those interested in getting a root canal done because there's a need, I know there's a lot of fear around root canals. What would you say to reassure the public if they need to have this procedure done?
Well, this procedure has, as we've discussed over time, has its perceptions and the fears that have gone along in society. But I would say, don't let what you hear be what influences your final decision. Things are not as bad as they appear to be. You can't make your decision based off of the experience of somebody else. Everybody is different. Everybody's body reacts to things differently. And as we said, there are things that we have in place. We have our x-rays, so we can x-ray the teeth. We have the CBCT machines, which give us 3D images, which can help us to make our approaches even more specific to your particular case. And so we can tailor make our approaches to you to help to make things more comfortable for you in terms of your treatment process. It's not just about going in your mouth and just drilling a hole in your tooth and just bam, 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 bam. It's about the person and about making sure that you are okay, so that as we work on your tooth is okay and you are okay as well.
I love that you mentioned we are looking at the person. Root canals then help to enable persons to live full, healthy lives and will not impact any other aspects of their health, I imagine.
It does not. Everything that's done in root canal treatment is contained within the tooth.
Yes.
The materials that we use do not react with the body. They are inert materials that we use. And as I said, it's housed within the tooth. We don't put anything outside. So we're not injecting anything into your gum, your bone, anything like that through the tooth. It's contained within the tooth, and your tooth sits there and it functions as per usual. There are materials that were used back in the past that did have, but as with medicine, you learn, you grow, you alter, you change, and you make those improvements.
And the studies continue.
And the research continues every single day. I have friends and colleagues who are deep into research, working on different materials to enhance how it is that we do the root canal procedure, the materials that we use, so we can have the best environment available for healing and function for the patients as the years go by.
Dr. Williams-Beecher, you said that you were cleaning out the house and a roof was needed. So after the root canal, that's not the end.
Nope.
What should be done after a root canal?
So after root canal treatment is finished, because as I said, we work inside the tooth. So there is the opening that we would have gone through in order to get inside the tooth. First of all, that needs to be restored. Most times there is an opening to the tooth because there's a reason why the inside of the tooth was affected. There must be an opening in the tooth for bacteria or something to get inside the tooth to have caused that infection, or you were doing a filling got pretty deep, it came close to the nerve. Yes, you don't have an infection, but because things came so close, the nerve got irritated. And in order to get you comfortable, we just have to take it out. So we have to replace that tooth structure that's missing first of all. And then when it comes to our back teeth, as we call them, so the premolars and molars, which take the bulk of the chewing and the occlusal forces, sometimes we have to use the big words, but those forces when we bite down or just regular sitting here and not doing anything. So,
or the persons who grind
and clench their teeth, who will need more than just the crowns that I'm recommending. So the crown is a covering or capping, as Jamaicans would say, that goes over the entire top of the tooth, which helps to maintain the tooth structure and reduce the risk of fractures and breakages over time. Because what has happened in the past is a lot of people have gotten root canal treatments, but in terms of the restorative portion, especially placing crowns on teeth that are severely structurally compromised, that has not been done. And so months, weeks, even years, they will function, everything seems okay, but then the tooth cracks open. That has nothing to do with the root canal treatment. That's just a structural flaw of the tooth, and because there's no protection, it breaks down. But the poor endodontist and the root canal treatment gets the blame because that's the last procedure that was done on the tooth. So a lot of times when patients talk about root canal treatments failing, it's about the fracturing of the tooth and not necessarily an issue with the root canal treatment itself. But if the tooth fractures or breaks, bacteria will get inside the tooth, and we're going to have that infection process starting all over again.
So, and I know sometimes you put a little whitening on the tooth before we end up with the crown. But how accessible is endodontic treatment in Jamaica? And are there any low-cost options for care for those who need it?
Low-cost options, that's always a tricky word or a tricky phrase in terms of dentistry, because as far as we're concerned, everything in dentistry is expensive. But in terms of root canal treatments can be done by your general dentist. It's not only done by the specialist. So the specialist usually gets the more complicated cases. So the molars, I mean, the 3 rooted teeth, the 5, 6, 7 canals that are there inside the tooth. But your general dentist can do root canal treatments. But when it gets more complicated, as I said, you will see the specialist. Currently in Jamaica, there are about 5 of us as specialists. So prevention is always important because there's only so many people we can see at any given time. Low-cost options, I would say, go to your dentist and visit your dentist regularly, so you will do the low-cost preventative options such as your cleanings, your sealants, your fluoride treatments, and in worst case scenario, your simple fillings, so you do not get to the stage where you actually need the root canal treatments unless you absolutely need to, because no matter what we do, it takes a lot in terms of cost and materials for root canal treatments to be done, so there's only so much we can do in terms of the cost. So in terms of low cost, it's really prevention.
Dr. Williams-Beecher, every guest on Watch Your Mouth is asked to give us one parting word, like a last lick, as we say in Jamaica. What's yours?
Lie.
Lie?
Lie.
All right, tell me more.
There's so many misconceptions out there about root canal treatments and the effect that it can have on your body, on your health, and all these things. It's just lies, plain lies. And it's so important for us to educate ourselves and read and appreciate the information that your dentist give you. We spend the time and the money and the energy to learn these things so we can present to you the best way forward for you in terms of your health. So stop follow the lie then, please.
And listen to things like our podcast, Watch Your Mouth, that will give the truth about oral health. That brings us to the end of today's episode of Watch Your Mouth. A huge thank you to Dr. Caithlin Williams-Beecher, our Endo Queen, for sharing her expertise and helping us understand the amazing ways endodontics can save smiles and lives. Remember, root canals aren't as scary as they seem, and they play a key role in keeping our teeth healthy. Thanks for listening or watching, and don't forget to join us for more episodes of Watch Your Mouth. Keep smiling and stay tuned for more ways to keep your oral health in check.